The Chair lays before the House a communication from the Speaker.
The Speaker's Rooms, Washington, D.C., July 29, 2008. I hereby appoint the Honorable André Carson to act as Speaker Pro Tempore on this day. Signed, Nancy Pelosi, Speaker of the House of Representatives.
Pursuant to the order of the House of January 4, 2007, the Chair will now recognize members from lists submitted by the majority and minority leaders for morning hour debate. The Chair recognizes the gentlewoman from California, Madam Roybal Allard. The gentlewoman will suspend. The Chair will receive a message.
Mr. Speaker, a message from the Senate.
Mr. Speaker,
Madam Secretary.
I have been directed by the Senate to inform the House that the Senate has passed S. 3352 to temporarily extend the programs under the Higher Education Act of 1965, in which the concurrence of the House is requested.
The gentlewoman is recognized.
Mr. Speaker, the future health of America is at a crossroad, requiring us to make a critical decision. Will we choose the road that promises a healthier future for all Americans, or will we choose to continue down the path that has led the United States to lag behind 28 United Nations countries in life expectancy? Incredibly, the United States annually spends $2.2 trillion on health care, more than any other nation. 75% of that health care budget is spent largely on preventable chronic disease conditions, yet the United States has the highest rate of preventable deaths among the majority of industrialized nations. Even more troubling is the fact that the number of people in the United States with preventable chronic diseases continues to rise steadily. If unchecked, public health experts agree that nearly half of our population will suffer from at least one chronic disease by the year 2025. Mr. Speaker, we can no longer ignore the science that links nearly 60% of premature deaths in our country to preventable environmental conditions, social circumstances, or negative behavioral choices. We have known for almost a decade, for example, that being overweight and physically inactive accounts for more than 300,000 premature deaths each year in the United States, second only to tobacco-related deaths. While we continue to ignore this preventable reality, our nation's obesity epidemic shows no signs of abating. It may very well be that today's children will be the first in a generation to have shorter, less healthy lives than their parents. However, there is good news. The road to a healthy future often requires only simple, small choices that have proven to be effective in reducing the incidence and severity of many chronic diseases. They include better eating habits, exercising more, and taking an aspirin every day. Unfortunately, these proven preventive strategies fail to reach large numbers of people at risk for chronic diseases. One reason for failure is our health system continues to prioritize medical care based on disease treatment rather than health care focused on prevention and control of diseases before they become more costly and difficult to treat. Next year, as a new Congress and a new administration work to fix our broken health care system, it is imperative we prioritize disease prevention and public health in the formation of any health policy. For that reason, I am introducing a resolution today calling for an increased federal commitment to prevention and public health. I am pleased to be joined in this effort by my co-chairs from the Study Group on Public Health, Representatives Jim McGovern and Kay Granger, Representative Jim Moran from the Prevention Caucus, and Representative Diane DeGette of the Diabetes Caucus. Mr. Speaker, the future health of our country is at a critical point in our history. New research has shown that investing in clinical and community-level prevention saves lives and significantly reduces health care costs. It is therefore essential that the road we choose to a timely, accessible, effective, and affordable health care system includes a focus on public health and prevention. Both are key elements to reaching our goal of a strong and healthy nation. I urge my colleagues to support this resolution. I yield back the balance of my time.
The gentlewoman yields back her time. Pursuant to Clause 12A of Rule 1, the Chair declares the House in recess until noon today.